Welcome to Health Matters with the Medicine Center Pharmacy. I'm your pharmacist, Paul White. We're very glad you joined us. Before we begin, I'd like to thank our sponsors, Altman Health System, Studio Arts and Glass, and Genier Appraisals and Liquidations. Today, Brad and I are broadcasting from our administrative offices, and our special guest is Jim Adams, Health Commissioner for Canton City Public Health. Good morning, Jim, and welcome back to the show.
Good morning, Paul. Good morning, Brad.
Good morning. Public health is the science of protecting and improving the health of people and their communities. The work is achieved by promoting healthy lifestyles, researching disease and injury prevention, and detecting, preventing, and responding to infectious diseases. Overall, public health is concerned with protecting the health of the entire population. Public health professionals try to prevent problems from happening or recurring through implementing educational programs, recommending policies, administering services, and conducting research. In contrast to clinical professionals like doctors and nurses who focus primarily on treating individuals after they become sick or injured. Public health works also helps limit health disparities. Large part of public health is promoting healthcare equity, quality, and accessibility. Jim Adams and staff at the Canton City Public Health deserve our thanks and appreciation for all they do to keep us and our community healthy. We'd like to remind our listeners our program is available on our podcast. Just look for Health Matters with the Medicine Center Pharmacy in your favorite podcast app, and please subscribe to our program.
Okay, Jim, welcome back again to the show. Tell us a little bit about yourself and introduce yourself to our listeners, please.
Yes, and thank you, Brad, for that nice summary about what public health does in the community. I'm going to write that down and keep it as a memento. I thought you did an excellent job there. So, yeah, I've been the Health Commissioner of Canton City Public Health since 2008. I've been with the department since 1985. My background is environmental health and epidemiology. You might recall that we're one of 4 health departments located in Stark County. So Canton, of course, being the largest city and the county seat. We also have 2 smaller departments in Alliance and Massillon. And then the remainder of the county is served by Stark County Combined General Health District.
So I guess in the last couple of years, it's been kind of hellacious down there with all the vaccine and corona and all this stuff going on. Much different than past time, I would think. At least it's been a long time since we've had anything like this. And I'm not sure we've had anything like this in modern times. So anyway, let's start with where we are with COVID today. I understand Stark County is currently considered medium. What does that mean for our listeners?
Sure. So you're talking about the COVID alert levels that the CDC tracks. They classify a county as either low, medium, or high concern for COVID. Actually, as of yesterday, Stark County went down to the low level, so it's in the green level. So, that is reflective of the number of new COVID cases in the community and the burden on the healthcare system because of COVID. So both those indicators have been trending down in the last 7 days. And so we are now in the green level, but that will vary fairly quickly over time. So the basic concepts of protecting ourselves from COVID remain the same regardless of our alert level. And that is, be mindful of a respiratory illness. If we are ill, we should stay home, wash your hands frequently, cover your cough, mind your respiratory etiquette. And then most importantly, we have at least two respiratory illnesses that we have effective vaccines for, and that is COVID and flu. So we should remain current with the current vaccine recommendations.
So talk to our listeners about the new booster and the current recommendations for COVID vaccinations.
Sure. So COVID boosting is, it kind of varies by age, but, we are recommending that people complete their primary series and also have at least one booster with the new bivalent booster. So the new booster has components of both the original Omicron variant and the BA4 variant. And both of those are kind of well matched to the circulating variants that are right now. And while they won't prevent all illnesses, they certainly are very highly effective at preventing severe illness and preventing the illness progressing to a condition that might cause death from COVID. So very important to get that primary series done of the two vaccines, and then at least one booster of the Omicron of the bivalent variety. Currently, we're not really recommending J&J vaccine as part of your primary series. There are a few people that will select J&J because of other considerations, but we're mostly looking for the mRNA vaccines, which is the Pfizer and the Moderna.
Interesting. So schools are back in session and the transmission rates are increasing. What should we do to keep our school-age population safe?
Sure. So our goal always is to have students in school and learning. It's important for the students. It's important for families to maintain that consistency in the learning environment. Schools are challenged this year because this is the first full year that we're coming back in the classroom. We usually have seasonal respiratory illnesses, and they do increase once the school season starts. So schools are being a little more strict about excluding children from classes if they do have a respiratory illness. It is important for children to be vaccinated for both COVID and flu. Vaccines are available for children 6 months and older. And also, be mindful of that respiratory etiquette while they are in class.
So symptoms the same for children similar to adults? And
They are similar. Children usually have a milder form of the illness. In fact, they may be actually asymptomatic, which makes it, obviously very difficult to detect, but they generally do have a milder form of the illness or milder symptoms.
what about testing our children? I guess the tests are readily available, and I think we just got a whole new load of them in. So what do we
Yeah,
do?
testing is a great strategy. We have not really implemented in the United States a really effective testing strategy for keeping kids in school or frankly people at work either. But testing is a great strategy. If you think you've been exposed to COVID, you should wear a mask for 5 days, test on the 6th day, and then take appropriate action based upon the results of that test. But testing is a great strategy for helping control the spread of the illness in the community.
We are hearing for the last couple of years that symptoms vary with all kinds of symptoms. I had it. I was drowsy. I was tired for 2 days, but that was it. But I hear sore throats. I hear all this other kind of stuff. So there doesn't seem to be any standard symptom. Is that true?
No, it's a very broad range of symptoms, like I mentioned, from asymptomatic, where you don't notice any symptoms at all, to severe symptoms with shortness of breath, mental confusion, difficulty staying awake. Those are some of the most severe symptoms that require emergency type treatment. But the broad range of symptoms are, stuffy nose, cough, sore throat, sometimes a headache, sometimes a fever, but not always. Generally speaking, early on in the pandemic, one of the hallmark symptoms was the loss of taste and smell. That kind of rarely happens now. It's not as common with the newer variants as it was with the original strain of the coronavirus.
So I hear customers talking about having COVID multiple times. And what are reinfection rates like for COVID?
Yeah, certainly reinfection is a real thing, and it does happen. Reinfection can happen after a primary illness or even after vaccination or any combination of the two. I did try to look that up because you'd asked that question a little earlier. CDC is still working on some studies to really kind of get a good idea of what reinfection looks like and what the reinfection rates are, but we're not really sure exactly, what those rates are and what those characteristics are right now.
Interesting.
All right, let's switch gears to another health concern. Can you tell our listeners a little bit about what monkeypox is and what is the risk to the general public?
Yeah, so monkeypox is classified as an orthopox virus. It's related to the same class of viruses that cause other pox-like illnesses. The classic would be smallpox, but it is not smallpox, but it is a virus that's related to smallpox. And it can be a severe illness. It is not widely spread through the community. So monkeypox is a disease that can be infectious, but it takes very close skin to skin contact. So we know that it's generally not spread through the respiratory route, like a respiratory infectious disease. It's not rarely spread through inanimate objects like clothing or cups or saucers or anything like that. It can happen, but it's very rare. So the primary route of transmission is through very close skin-to-skin contact with open lesions. The disease itself starts out as like a rash. Sometimes there's a fever, a headache. Occasionally there's what they call a flu-like prodrome, which is like before the rash starts, kind of feel achy, before the actual rash starts. Then it develops into a rash that looks like many other skin rashes. So it's very difficult to diagnose in its early stages. But then it progresses to pustules, which eventually scab over and then fall off. And that becomes very characteristic once the disease progresses a little bit. There are tests available at the lab for it. If you go see your doctor, they can specifically test for monkeypox infection early in the infection process. There is a vaccine that is available. It is a vaccine that was originally licensed for smallpox, but it's also been cleared to be used under an emergency investigative use for monkeypox. But it is a disease that can be controlled through behavior change. And so right now, most people that become infected with monkeypox, they have done so through very close skin-to-skin contact. Generally, they have multiple sex partners. A lot of times, the partners may be anonymous, and it's that close skin-to-skin contact that is really the issue with the monkeypox transmission.
Interesting.
So that suggests, yes, Paul, that suggests that the way to control it, a very effective way to control it, is avoid this close skin-to-skin contact with people you don't know or people that have rashes or lesions, things like that. So it can be very effectively controlled through our behaviors.
Okay, somebody's going to ask, shaking hands?
Nope, not shaking hands.
Okay.
No,
That's
not casual contact. Very close, very intimate skin-to-skin contact.
I figured I would get
Yeah, don't make me draw you a picture.
I know. Okay. Okay. It's time for our first break. You're listening to Health Matters with the Medicine Center Pharmacy. Health Matters with the Medicine Center Pharmacy. Friends, don't forget to stop in for your flu shot or COVID booster. Walk-ins are welcome and appointments can be made at our website, midshoprx.com. We look forward to helping you stay healthy. And we continue to welcome our Dartmouth Pharmacy customers. As you know, we purchased the Dartmouth Pharmacy, and we are very happy to have brought some of their staff on board. So please stop by and check us out.
All right. Before the break, Jim, we were talking about monkeypox, and you gave us some tips about, how it's transmitted and that there is a vaccine available. Is there a vaccine available locally, and what are the criteria to get a vaccine?
Yeah, there's a very limited supply of vaccine available locally. It has some very specific criteria and risk groups for the administration. It's not available to the general public. So if needed, we would make vaccine available to people that were closely exposed to known cases of monkeypox, healthcare providers that might be exposed, things like that. But we do not have any vaccine that's generally available to the public. Right now, Stark County is reporting 3 cases of monkeypox in the county, so that's a fairly low number. The state of Ohio is reporting 259 cases totally. Most of those cases are centered in Cuyahoga County. It is tending to be the epicenter of the monkeypox outbreak in Ohio right now. And that's followed by Franklin County, Columbus, and then lastly Cincinnati and Hamilton County. But we have not had many cases, and we have not had any significant clusters of cases in our community.
Okay, good information. All right. So I guess then just one more monkeypox question. If you suspect you've been exposed, what are the next steps to take to be proactive?
Yeah, the first thing you should do is really go talk to your medical provider. So I would contact my doctor right away. If you feel like you've had an exposure or you've been contacted by a health department because of an exposure, they will walk you through what you need to do next. But if you have not been contacted by public health authorities about it, and you feel like you've had an exposure, you should talk to your physician right away. If you have an unexplained new rash, and you have some of the risk factors, you should talk to your physician and they can walk you through the process for that.
Probably going to get this question asked too. I think about every one of us have had the vaccine years and years ago.
Mhm.
And is it still effective? And would this prevent monkeypox?
Yeah, that's a great question, Paul. You and I are talking about the original smallpox vaccine.
Correct.
That has not been cleared for use in monkeypox. That vaccine is still available. It is still used in certain situations, but about 6 or 7 years ago, can't remember the exact time frame, a new vaccine was developed called Genios. It's a 2-shot series. It's made with a killed virus. That has been, it's licensed for smallpox and has been cleared for use in monkeypox as part of this investigation. But the original smallpox vaccine that you and I got years ago with a little scab on our arm is not available for use in monkeypox.
It's interesting. I mean, every kid in the world got that in school. I mean, that's where it happened,
Yeah, and that is an amazing story. That is really the only infectious disease that has been eliminated through the use of vaccination. And the vaccine itself had a fairly high problems with side effects. And so one of the reasons that they were so aggressive in trying to eliminate smallpox is to eliminate the use of the vaccine. And smallpox itself, of course, is a very devastating, illness, caused very high case fatality rates. If you did survive, you had a lot of scarring, on your skin and things. But, the vaccine itself was, at least from our modern vaccines, was not as safe as our modern vaccines are. And that's been the only vaccine that has totally eliminated a virus in the wild.
Interesting. It was interesting the way they discovered that with cowpox and produced that original whatever thing clear back in the 1700s. I think they came up with that. So very interesting.
It's where we got the name vaccine. The original cowpox virus was called vaccinia. And the term they started using when they started inoculating people with this cowpox virus was vaccination, from the term vaccinia. So it goes all the way back to the 1700s.
Took a trip to Eli Lilly years ago, and in their farm they actually had the cattle that they were scraping the cowpox off of to produce the smallpox vaccine, which I thought was really kind of crude, but I guess it worked, So, okay, Jim, it's the annual flu vaccine season. Can you talk about to our listeners about the importance of the flu vaccine and who?
Yeah, this has been unusual. The last 2.5 years or so, we've had a very interesting real life experiment in what we can do relative to non-pharmaceutical interventions to help prevent flu. And that is, staying home, not having school classes, wearing face coverings when you're out in public, staying home much more often when you're ill. And so for the last 2 years, we've had actually very low flu rates within our country and actually worldwide. So this is the first year that we're going to have, a much more normal exposure to the flu virus in the community. So we think the CDC and others think the flu season for North America is going to be worse than it was over the last 2 years. The Southern Hemisphere is just coming off their flu season, and they are seeing, higher rates of flu, higher rates of fatalities due to flu, much higher rates of children being ill with flu. And we expect the same in North America. We are lucky in that the flu vaccine that has been developed for this flu season, it seems to be at least well matched to the flu viruses that are circulating in the South America. So it seems like a good match. So it's going to be very, very important, more this year than previous years, to get that flu shot.
Very interesting. So what you're saying, and what we've heard, of course, is that the masking for the coronavirus is that it helped hold down the flu last year. Is that correct?
Right. Yeah, the combination of spreading people out and staying home, it really has held down the flu virus and other respiratory illnesses too. So, we have other respiratory illnesses that circulate, particularly in the fall and winter. RSV, cold viruses, other coronaviruses don't cause COVID, but cause these respiratory illnesses. And, the control for those are still very effective. And, we proved it during COVID that we could control the spread of COVID even without a vaccine.
Very interesting. Okay. Jim's time for the news. You're listening to Health Matters with the Medicine Center Pharmacy. Listening to Health Matters with the Medicine Center Pharmacy. I am your host, Paul White. This morning, Brad and I are talking with Jim Adams, Health Commissioner for Canton City Public Health. So we've got a lot more to cover this morning, so let's get back to the show. We did just talk about predictions and indicators for this year's flu season. And you did mention that the southern hemisphere is coming off of their flu, and that would be South America. Is that where we are?
Mainly, the studies mainly center around Australia. They're the ones that really kind of the leading predictors for our fall flu season. So most of the data comes out of Australia.
So that's where we get our prediction for how bad it's going to be, or how bad it's not going to be.
Right.
Okay. Interesting. So does the health department recommend getting both COVID vaccine and flu vaccine at the same time? Yes,
they can be administered at the same time. We recommend that you do get your booster for your COVID, and it's perfectly okay to get a booster or your flu vaccine at the same time.
Very good. Okay, Jim, I was shocked to read that we lose more residents in Stark County each year due to drug-related deaths than any other injury during car accidents. Can you tell us a little bit about the scope of the problem in our community?
Yeah, so, we're talking about opioid addiction, a little outside of my normal range of experience, but we do have some programming that aims toward harm reduction for folks that are especially that are using injectable drugs because of their opioid addiction. So it is a significant problem. The last data that I looked at was published in 2020. I'm sure there's more recent data, but I just didn't have ready access to it. We had 131 individuals die from an overdose in 2020. And so that is a tragedy for every life that's lost, but it's a particular tragedy because most of these lives are younger people. So, all that potential that they had in their life is now gone, and it's a tragedy for their families, and it's a tragedy for the communities. So it's very important for us as a community to think about this issue and to provide the supports and the services necessary for people to help treat their addictive disease and not succumb to these overdoses.
Interesting.
Yeah, it is. I don't know. We get questions in the pharmacy sometimes, and we do our best to educate patients. And the thing that I think is interesting, and it's probably worth touching on that, I know we're going to talk about Narcan here in a minute, but sometimes you can be at risk as a patient taking some medications for a condition you're treating and not realize that you might be more at risk for a drug overdose than you would be normally. So I think that that's something, if you are taking pain medications, please talk to your pharmacist, talk to your doctor. Don't be so proud to think you're tough and everything will be fine. I mean, one little extra medication or change in lifestyle habit could put you at more risk. So just be careful with that.
Yeah, that's great advice, Brad. And, most, people have access to really great healthcare team. And, you have your physician, you have the nurses that assist the physician, and you have the pharmacists that are all looking out for the health of the individual. And, the pharmacy part is extremely important because you're looking at your patients and making sure that there's no drug interactions, that the dosing is appropriate, and really providing that double check to make sure that people can use their medication safely because, they are needed, but not pose themselves at a greater risk than what they need to be.
Interesting.
So, in the news, you often read that fentanyl is responsible for a large percentage of overdose deaths. And I guess at the health department or at Canton Public Health, you guys have test strips available to test your drug supply. Can you talk about that?
Sure. So we do operate a harm reduction clinic at our health department. It is Friday afternoons from 2 to 4. And we provide a variety of services at that clinic. We provide wound care for people that might need some help with wounds or infections caused by their injectable drug use. We also provide test strips for fentanyl if people do that. And, we would advise, people that use injectable drugs to test their drug supply for fentanyl contamination. And those test strips are available. We also make available mental health services and services for people that would like to get into treatment for their addictive disease at the clinic. So we have a variety of services available at that harm reduction clinic.
I also know that our pharmacy has participated with it, but residents can receive Narcan by mail if they have for an emergency. I think it's called Project Dawn. Is that correct? Can you talk about that?
Yeah, Project Dawn was one of the original programs that provided provided Narcan in the community. Narcan is a very safe drug that will reverse the effects of an overdose, quite quickly. Project Dawn its aim is to get this Narcan out into the community so that people have access to it if they happen to, have a friend or a loved one or, can help somebody reverse the effects of an overdose. The goal is to make sure that we can have have folks survive this potential overdose and eventually get into some kind of treatment to prevent future overdoses. So we can distribute Narcan by mail on our website at cantonhealth.org. We have a link towards the bottom about our overdose prevention programming. And there's a simple form on there. You can fill that out and we'll be happy to mail you Narcan in the mail.
And, I'd like to add one little thing about maybe debunking a stigma myth, if you wouldn't mind. I think it's would be interesting for patients and listeners to know that if you're taking something for chronic pain and maybe your doctor recognizes and you talk to your doctor and you have some anxiety and maybe they add a drug for anxiety. Once you add those two together, you're at a higher risk for an overdose. So overdoses just aren't people that are maybe, down on their luck using drugs to find an escape. Overdoses can be you, the patient, treating chronic back pain on a daily basis and are really depressed about your situation. So it's one of those things that, just again, ask questions of your doctor and provider and don't be caught off guard if you walk into the pharmacy and we ask you about, hey, have you heard of Narcan? Because it may be something you want to have on hand just in case. I mean, everybody's forgotten to take a dose of something, or maybe you forget and take something twice. If you take your dose twice by accident, you could be at risk. So it's not a judgment. It's just an opportunity to keep you safe. So
excellent.
So let's, in the spirit of taking care of each other, I know in Stark County, the tagline for Know the Overdose campaign. Well, what's important for listeners to know so that we can help friends, neighbors, or relatives who may be in this situation?
Yeah. There's a couple of things to remember about that. And the first one is that if you have an addictive disorder, it is a disease that can be treated. So it's not simply a choice. It's not simply a lifestyle choice. It is a disease, and we, in general, are okay with treating diseases. So we should look at issues related to that just like we would any other illness. And so, much like you pointed out, Brad, that somebody might be, have a depressive disorder and they want to be able to get better, we need to treat that like we would any other disease. So, let's not put a stigma on that particular disease. Let's make sure that we can talk about it in a way that is helpful to other people. The other thing is that, we don't want to stigmatize or marginalize people that are in that cycle. It is a horrible illness. It destroys families. It destroys, your ability to interact with the community in a positive way. So we want people to get better, and we really just want people to come out and get the help that they need in order to cure their illness.
Interesting. Never in my lifetime did I think we'd have concerns for possible resurgence of polio. Can you talk about polio?
Yeah, what an interesting summer. So, in the middle of the summer, in one of the New York counties around New York City, they identified an individual that had a paralytic polio. Polio, as some of us may recall that have been around, it's a devastating illness in its paralytic form, very high mortality rate. We might have seen in the history books, people lined up in iron lung machines because of the paralysis. So they were in these devices that helped them breathe until they regained some of their function. It has lifelong implications. I've talked with people that have had polio and they still have issues with walking. We had a president who was in a wheelchair because of his polio disease. So, it is a devastating illness, and we've not seen paralytic polio in the United States for many, many, many years. But we had this individual in New York that had paralytic polio. They believe they've kind of traced down the source of his infection, but the most concerning part is that in at least 3 New York counties, they do surveys on wastewater. And what they do is they take samples of wastewater from the wastewater treatment plant, and they look for little pieces of virus from various diseases. COVID is one of them. We do wastewater surveillance for COVID to help predict when we're going to have a surge in COVID cases. But another one is polio. And so they have found polio, at least the pieces of polio virus in at least 3 counties in these wastewater systems. So, public health officials believe that there are more cases of polio out in the community, in the wild. They may have not caused a severe illness, or they may have caused an illness that had no symptoms, but yet the potential for transmitting it to people who could develop into paralytic polio is quite high. Now, this is another example of a very successful vaccine preventable disease. The reason why we've not seen polio in the United States for a number of years is because we used to have vaccination rates for polio in the 98% range. And so as you know, by giving vaccines, polio is one of the required vaccines for children as they grow up. Our vaccine rates for polio have slipped steadily over the last few years because of vaccine hesitancy in the community. Some of that was driven by vaccine hesitancy around COVID, but vaccine hesitancy started even before COVID did. So we think that in our area, the vaccine rate for polio is slightly less than 90%. It needs to be around 98% to be highly protective for the illness. So very concerning that we have a cohort of children that are not properly vaccinated for polio, or adults that have not been properly vaccinated for polio, and yet we're starting to see this virus circulate in the community. So very concerning.
Gosh. The Rotary Club International, the National Rotary Club International actually has been involved with Gates on this thing on a huge worldwide. And there's only 3 areas, I think, in the world, or 2 that I thought it was very interesting when this one area that they have had to give multiple vaccines of polio to some individuals because their bodily defense system destroys the vaccine. And I'm thinking, my gosh, how unusual is that on anything? So
same kind of issue is with smallpox to a certain extent also. There are some people who, are not, even despite getting the vaccine, or would still be vulnerable to smallpox. But the idea was to have enough vaccinated people in the community to really halt the spread of the transmission of the virus in the wild. And, you mentioned that, Paul, that, there has been a worldwide effort to eradicate polio, but it's been very persistent in a few of these areas. Some of it's related to the type of vaccines that are used. Some of it's related to the culture of the community.
Sure.
But, if enough effort is put into it, we could do to polio what we've done to smallpox.
Right. Okay, our final break is here. You're listening to Health Matters with the Medicine Center Pharmacy. It wasn't that long ago that there was a resurgence of measles, and they were really pushing the vaccine. Why are we seeing resurgences of vaccines that we thought were eradicated?
Sure. So like we talked about with polio, we've seen these declining rates of childhood vaccination for vaccine preventable diseases. And as those rates drop, it leaves a vulnerable population. So really the most important thing we can do with some of these illnesses is make sure we keep up with that vaccination schedule. We've got a long history of vaccines. The vaccine approval process in the United States is very rigorous. Safety is always the number one factor for evaluating these vaccines. And as we even saw through COVID, we had a quick development of vaccine, but it still went through the very same safety review process that all other vaccines go through. And so, it is frankly a medical miracle that we do have these vaccines that are highly effective at preventing illness, have a very good safety track record. And, we need to make sure that our kids and our adults are protected where we can.
I think it's incredible the amount of vaccines that the young children, the babies, do get. I think something like 30 vaccines or something along that line. I'm thinking, oh my gosh, those poor kids when they go to the doctor,
Yeah.
probably absolutely scared to death to walk in the door. So, but anyway, it's all for good. So
It is.
all for good.
Hey, Jim, we've talked a lot about COVID vaccines and flu vaccines and monkeypox and stuff today. Can you take a minute and just touch on the other services that Canton Public Health offers the community that are hidden gems that you want listeners to know about?
Oh, that's a great question. We do provide a variety of programming in the community. People have said that if public health does its job well, you just don't know we exist because people don't get sick. We live healthy and happy lives. So a few of the things that we've been doing, putting a lot of effort into is one is we run what's called an air pollution monitoring system within the county. So we are representatives of the Ohio EPA for air pollution in all of Stark County. We permit facilities on their air pollution control sources. We also run an air monitoring network so that when you hear the air quality index for Stark County, that is us that's doing that monitoring and reporting out. We also do it to monitor compliance with federal clean air standards. We also do a mold and pollen monitoring within the community too. So for folks that are kind of coming into the fall allergy season, we do regular mold and pollen counts that help guide physicians and individuals on prevention for some of their allergies and things like that. You mentioned at the top of the show, Brad, the importance of health equity in the community. So we have really started some programming within our department to look at how we are addressing issues of health equity, in particular around the notion of race and racism and its impact that it's had on health inequities in the community. So, we are very serious about changing our culture within the department to be able to talk about these issues in an open and honest way in order to get to a place where we have greater health equity in the community. So that's been a great challenge for us, and looking forward to continuing that work also. Nursing division, we do a lot of work around HIV programming and STD prevention. We've recently published a report summarizing sexually transmitted infections in Stark County, and that is helping us guide some further programming work around preventing sexually transmitted infections and HIV in the community. And of course, our infant vitality programming still continues also in order to help lower infant mortality rates, which still are persistently high. And more importantly, the disparity we see in infant mortality rates, which talks about our focus on health equity. So lots going on in the department.
Is the syringe exchange program still going?
Yeah, so when I mentioned our harm reduction programming, that is the syringe exchange program is part of that harm reduction clinic that we do on Fridays. So
okay. Syringe
exchange is a big thing. We want, if people are using injectable drugs, we of course want to avoid spreading illnesses from one person to another. So clean needles are very important for that. It's also important for the individual to use clean needles so they don't get infections from that use. But like, as I mentioned before, we also layer other services on top of that. The availability of counseling, mental health services, the test strips, Narcan, all those kinds of things that go with it.
Interesting.
All right, Jim, we're getting close on time. How about you share your contact information and your website with the community?
Sure. So you can find us on the web, just like everybody else. Our web address is cantonhealth.org. Phone number is 330-489-3231. And we'd be happy to answer anybody's questions about just about anything.
All right. Any key info you want to leave for a takeaway today with the listeners?
Yeah, I think from the takeaway from our discussion today is that, even though we're coming into the fall respiratory illness season, and there are lots of things we can do to help slow the spread of respiratory illnesses in our community. Number one is stay home if you're ill. Number two is practice good respiratory etiquette. Wear a mask if you're ill, wash your hands frequently. And lastly, we have several respiratory illnesses that are vaccine preventable. So make sure you get your COVID shot and keep up to date with your booster and get your flu vaccine.
Interesting. What's your prediction for the weather this winter?
The weather this winter will be winter weather.
Okay. There's two almanacs out there. One says it's bad and one says it's good.
It'll be one of those two.
Yeah, I know. It's crazy. Okay. Thank you very much, Jim Adams, Health Commissioner for Canton City Public Health. We'd like to remind our listeners, if you suspect you have a medical issue, please contact your healthcare provider. Thanks to our sponsors, Altman Health Systems, Studio Arts and Glass, and Genier Appraisals and Liquidations. As always, we thank our listeners for joining us on Health Matters with the Medicine Center Pharmacy. Have a healthy week, and we'll see you again next Friday right here on News Talk 1480 WHBC.
Yeah,
Thanks.
I will.
Okay.
That was pretty interesting.